Well, adherence is important to me as a community pharmacist, is obviously improving overall health. When I send an email to folks, I have a quote from Dr. Coop on there, former Surgeon General, says medication doesn't work in people that don't take the medicine. It's probably familiar to a lot of you. But it's true, we have to, along with education of letting them know why they're taking this medicine, we have to remind them to take them. Part of that education of teaching them why they want to take that medicine is let them know, hey, you have a disease, you have a condition, and that condition can be controlled by taking medications. If you do not take these medications, then you're going to end up having a blood pressure situation, having a stroke, having a heart attack, ending up in the hospital. Our healthcare costs are climbing dramatically a lot of times because of people that just refuse to take their medicine. When they took their medicine, they would not end up in the hospital in the ER, but we have people that don't take them. And it's also talking to your pharmacist, and where we come into role is people, a lot of times people don't take medicine because it makes them feel bad, or maybe they're having to take it 3 and 4 times a day and they can't remember to do it. But if they communicate that information rather than just not taking the medicine, we as pharmacists can help find a solution for that. We're problem solvers in the community, and we have easy access to us. So maybe we can find a medicine that is not causing the side effect and make them feel bad, or maybe we can find a medicine that takes fewer doses a day to help remember to take it, to be more compliant on a daily basis. At our pharmacy, we do a lot of blister packing, where we take medicine and put it in bubble cards or bingo cards, or even in medicine trays to help people remember to take them. Maybe we'll take and put all the medicine in the morning, or all the medicine at noon and in the evening all together. So instead of taking from 10 bottles, maybe they're just taking from 1 bottle. But the most important thing to me as a pharmacist in the community is communicating with your healthcare professionals and your pharmacists, and letting them know that we want where the problems are. I'm having trouble taking these medicines, or they're causing these side effects, or I need something to help me remember it. Technology's come into play these days. You can set yourself up where you get a text message, or you get an email, or your phone beeps, or your watch beeps, I guess I should say, to help you remember to take things. But it's critical to remember to take your medicine, just to reduce not only our healthcare costs that are skyrocketing, but also to protect your own personal health.
Hi, my name's Steven. I'm a pharmacist here at Bubba's Medicine Shop. And to me, patient adherence really is the backbone of what I do and what I do each day. And that is to be helpful, to be a servant in the community as a healthcare practitioner. To me, adherence is the cornerstone of good health for any patient that we have. So what I like to do is encourage folks, first of all, having good counseling up front, letting them know how their medicine is to be taken with each prescription is really something that's overlooked often but can't be overstated. And then the follow-up, when we notice that patients aren't getting their diabetes medicine or their blood pressure medicine on time, we like to call and find out what it is that is causing non-compliance, whether it's just forgetfulness, in which case we like to recommend pill finders and that kind of thing, or whether it's economic issue, in which case we like to talk with the doctors. We have good relationships with our local physicians, which is very important, so that we can get timely changes made for the patient if it's cost prohibitive problem. And then also just the encouragement to let them know and to re-educate them, constantly reinforcing the idea that these medicines are life-sustaining and needful. And so those things really, I think, are some of the backbone basic things that we can do as pharmacists to really help patients with adherence and help them with their overall health.
I think one of the most important things about patient adherence is that sometimes people don't truly understand how important it is to take their medication. That sometimes you may feel good whenever you're not taking your medicine, but truly it's doing damage to your body. So it's real important to take your medicine every day. It always makes me think back to a story we had of one of our patients. They actually called and said it was the best they felt since they weren't taking the medicine. They didn't think they needed to be on it anymore. And the sad thing is, 1 week later, they were put in the hospital. So it just kind of goes to show the importance of always taking your medication.